And here is your stem.
Okay, ma'am, I'm ready.
Okay, so if you've read and understood, considering it critical care scenario, please tell me, how are you going to manage this patient?
As patient had RTA, so I would manage this patient according to the ATLS protocol
Very good.
with BCDE,
Yes.
and I would rehydrate the patient at the rate of 300 ml per hour with crystalloid solution. I would also give patient diuretic like mannitol, and I would alkalinize the urine with sodium bicarbonate, and I would also monitor the patient's myoglobin, ECG, electrolytes, and I would also correct the electrolytes of the patient, and also will measure the compartment pressure.
Right. Okay. Along with the electrolytes, renal functions are also deranged. How are you going to take care of those first?
Yes, because renal failure in compartment syndrome occurs due to the secretion of the myoglobin that causes cast formation in the renal tubules and causes the tubular necrosis. So, rehydrating the patient and giving patient diuretic after the rehydration actually helps in preventing the cast formation in the renal tubules. And by alkalinizing the urine, it also helps to prevent the myoglobin cast formation in the renal tubules, which causes the uh, damage to the renal tubules.
Okay. What would be your choice of fluid for
Uh,
hydration?
I will give crystalloid solution.
Okay. How would you make sure patient undergoes forced diuresis?
Uh, well, I will give the patient 300 ml per hour, and I will also give diuretic like mannitol,
All
which is
right, very good.
hypertonic.
And what medications can you use in order to combat with raised potassium levels?
If there is hyperkalemia, I can
There
give.
is.
Yes, there is hyperkalemia, so I can also give patient uh, calcium gluconate along with 10 ml,
How much?
10% calcium, 10 ml, 10% calcium gluconate with insulin, 10 unit insulin, which can cause the shifting of the extracellular potassium into intracellular.
How in this situation, according to your opinion, or what is the hypothesis behind it, that acute kidney injury might have occurred? What is the pathogenesis behind it?
Yes, there are three causes of renal failure due to crush injury, which are pre-renal, renal, and post-renal. The renal cause is the myoglobin secretion that causes cast formation in the renal tubules, and it causes the damage of the renal tubules, causing acute tubular necrosis.
Very good.
And the
Okay.
pre-renal causes there
Thank you.
is
What is
yeah.
myoglobin?
Myoglobin is oxygen binding protein which is in the striated muscles.
Cardiac and skeleton, both. It is found in both. Okay. Please tell me, how much should be the normal compartment pressure?
Normal compartment pressure is between 0 to 15 millimeter of mercury.
Okay. When would you consider it to be high?
If it is more than 30 millimeter of mercury, it is considered high and it is an indication for fasciotomy.
Okay. And what are the clinical features? How would a patient presents who has compartment syndrome?
Okay, the compartment syndrome patient, the first symptom is severe pain which is out of proportion to the injury and not relieved by analgesia. There would be tense, swollen limbs. There would be paresthesia, 2-point discrimination, and there could be sensory loss and paralysis, and also pain on passive stretch.
Okay. How,
And breathlessness is a late sign, yes.
yes. Okay, what is the rule for fasciotomy? How is it carried out?
Okay, there are 4 compartments in the lower leg, and one incision is given dividing that divides the anterior compartment from the peroneal compartment, and another incision is given that releases the posterior
Okay.
compartment from the deep
What
posterior
kind of
compartment.
procedure is
One
fasciotomy?
is posterior. Fasciotomy is when the deep fascia
It's an emergency
underneath
procedure.
which
Yeah.
the muscle lies. It's an emergency procedure
Yes.
that actually is the division or the incision or cutting of deep fascia in which the muscles are of the leg.
Good. Okay. What is rhabdomyolysis?
Rhabdomyolysis is the
I can't hear you.
breakdown of the hemoglobin into the circulation after the breakdown of the muscular tissue.
Okay. What are the causes which lead to rhabdomyolysis?
Yes, blunt trauma, crush injury, severe burn, and hypothermia and hyperthermia, or ischemic reperfusion injury, which is caused by clamping the artery, or if someone has had a strenuous exercise, or if has been immobilized on a hard surface.
Okay. What is reperfusion injury?
Reperfusion injury is when ischemic area is reperfused. Uh, when reperfusion is injury is when metabolites of dead area are reperfused back to the ischemic area. That is called reperfusion injury.
Okay, if you fail to manage patient's acute kidney injury, what measures or can you carry out or you can offer this patient?
Uh, if Sorry, ma'am, can you repeat the question?
Yes, I said if you fail to manage acute kidney injury of this patient, what are the alternatives or measures that you can offer this patient or you can carry out?
Okay, that would be, I mean, if the acute kidney injury is not managed, that can raise creatinine. That might end up a patient having uremic encephalopathy, and we need to have a dialysis. If there is creatinine is above 7, or if uh, potassium is above 6.
Even more than 5.5 is alarming, potassium.
Yeah.
So, okay. Right. What are the different types of dialysis that can be carried out or can be offered to this patient?
Sorry, ma'am.
Okay, that is your homework question.
Okay, I'll look into it. Thank
Thanks.
you.